Speaking of, good morning. Welcome back to Senate Economic Development, Housing and General Affairs. We are here. It is Friday, January 24th. 24th. I'm going to own the 24th here. And we are here addressing housing. I think Fridays are going to be a big housing day as we look at trying to organize our time. And we're going to begin actually with people who have no housing. So we are going to begin with our terrific executive director of the Housing and Homeless Alliance of Vermont, Frank Knapp. And Frank, welcome to Senate Economic Development. Look, I think we'll just go around and introduce ourselves, but I'm not sure you actually know everybody.
I'm Tom Chittenden. I represent Chittenden Southeast. I don't know if we've met before, so it's nice to have you.
Thank you.
Tisha Hinsdale, Southeast.
Allison Clarkson, Windsor District.
Randy Brock, Brightwood, and part of Grand Isle.
Dave Weeks, Rutland. Saw you about a month ago.
Exactly.
Yeah, great.
Well,
It's yours. The floor is yours.
thank you also. Thank you for the opportunity to testify. My name is Frank Knapp with the Housing and Homelessness Alliance of Vermont. For those not familiar with HHAV, we are a statewide advocacy organization that wears two hats. And so for background, we're the result of a merger between the Vermont Affordable Housing Coalition and the Vermont Coalition to End Homelessness. You all are probably familiar with those organizations. They've been doing work in Vermont for many years, obviously coordinating quite closely because the solution to homelessness is permanent affordable housing. And so 2 summers ago came together and merged to create HHAV. And so with one of our hats, we engage in advocacy. So we, come to the legislature, we work in local government, we work with communities to educate folks around the various issues within housing, homelessness, and services. And our second hat is we are the collaborative applicant for the Balance of State Continuum of Care. And so for those not familiar with Continuum of Care, each state has one or more HUD-created mandated Continuum of Care, which is the homelessness response system for that geographic region. And so in Vermont, we have 2 COCs. We have the Chittenden County Homeless Alliance, which is the continuum of care for Chittenden County. And then we have what's called the Balance of State Continuum of Care. So that's continuum of care for all of the jurisdiction counties in Vermont, minus Chittenden. And so we functionally, as a collaborative applicant, staff the Balance of State Continuum of Care. And then obviously work very closely with the Chittenden County Homeless Alliance to have a statewide strategy and a statewide response to homelessness.
And sorry, just to clarify, continuum of care means moving them out of homelessness into housing, into shelters, into housing, hopefully. And then how much, and the supportive housing, how much further does that continuum of care go?
So it moves all the way through the cycle to even permanent, especially housing where they need supports and whatever that might look like. I think one of the issues right now with it is it's a system, but it requires outputs for the system to work. And so we have this great thing called coordinated entry, which enables us to kind of understand, if someone is unhoused or at risk of becoming unhoused, they come into the coordinated entry system, which enables us to kind of triage. But for us to be able to triage, we need the output. So we need to be able to have case management and services to support the individual. We also need to have permanent affordable housing for them to be able to exit. And so because we have kind of gaps in capacity around services and supports in case management, because we don't have enough housing units, we have the system works, but it's clogged because of that. And so we see backlogs because we just don't have the outputs in place. And so we see that in varying degrees in each jurisdiction across Vermont. And so if it's okay, maybe I can start with kind of what the problem is that we see and then talk about solutions. And so I think from our perspective, just to give a little context, so every year, state of Vermont, like all other states, engages in what's called the point in time count, which is on a specific given night each year, all jurisdictions across the country, all the COCs count the number of people who are unhoused and unsheltered. To understand kind of the universe of people who are unhoused across the United States. That count this year just occurred on January 22nd. And so right now we're going to be collecting that data, and that report should be ready later this spring. But looking at the hit count from last year, Vermont had approximately 3,500 unhoused people across our state, and that represented a record high number. And so just to give a little context of who that looked like, it included 737 children, 646 Vermonters over 55. And so we also know from other data sources reported at entry, for example, from just night counts in some of the shelters, that is a vast undercount. You know, how much of an undercount we don't know. But we know that's an undercount. And just to give some context, and I know you talked about this quite a bit in the committee about like what our actual capacity is on the shelter side of Vermont. So we have at least 3,500 unhoused people. We have a statewide shelter capacity right now of 585 beds. And so obviously there's a huge gap between 3,500 and 585. And so to fill that gap for folks who the legislature has deemed as vulnerable, we have the General Assistance Emergency Housing Program that is currently utilizing a little over 1,400 rooms. So we're talking for the GA program right now, 1,756 adults, approximately 414 children who are also sheltered through the emergency shelter hotel motel program.
So we're sheltering just over 1,900 people, just under 2,000 people.
So the 585 is households. So exactly what that means in terms of individuals varies depending on the night, but yes, approximately. And we could get, I'm not sure how much more precise we could get than that at this point. And so obviously that really shows we have a huge problem and the importance of the GA program. Also, I think it's really important. I know you've talked about Moira is in here talking about the BHFA, about the housing needs assessment and about really what we need to do in Vermont to actually get to the solution, which is housing for all who need it. And so as you all heard, from the most recent housing needs assessment, we need 24 to 36,000 additional homes by 2029 to meet the demand. But specifically within that, and relevant to this conversation, we need 3,295 homes to address homelessness, and then 3,957 additional homes to normalize vacancy rates. And I think vacancy rates is really important because obviously that impacts the cost. And one of the key drivers right now is the rising gap between wages and the costs of housing. And so as we get more production.
And I just want to point out that you have this report, that you have Frank's report on your desk. And that is, I think, a key thing that I think at least I'm understanding in our neck of the woods is increasingly it's money. I mean, that people are just that as post-COVID, as apartments are being renovated and owners are rethinking their use of some of those apartments and apartment buildings, at least in the Upper Valley, there are people who are now homeless just because they cannot A, find a place or B, afford it.
Exactly.
And so increasingly we're seeing that wage gap issue as a huge piece of this.
Exactly. And I think that's even, there's a section of the BHFA housing needs assessment that really notes that. They talk about rising rents and home costs and disproportionately impact low and middle income Vermonters. And so I think that data is represented quite well in that report. And so obviously that shows we have a problem with kind of the number of unhoused. We have an increasing number of people are becoming unhoused, and we know what the solution looks like, but it is, quite a number of new homes. Also, I think one of the issues, sorry.
Yeah, Dave.
Can I kind of pick parts in the numbers a little bit? Because we kind of cruise through this so fast.
Slow it down.
That's what.
Ask your question.
So I'm gonna go back up to the first paragraph of the report if I could. So 3,500 on-house Vermonters. How many of those are currently on-house, given the GA program and the
So
shelter?
like unsheltered homeless, I'd have to look at I don't have that specific number in front of me.
Okay.
But I know like anecdotally, there's a few hundred folks in Burlington alone from the data sets we've seen from there.
Okay. And then any thoughts on the 300% increase over those 4 years? On
For-
the source of, the whys?
I think it's a combination. I think one of the things is, because of COVID, more people came into the system, so we're able to actually count better the number of people are unhoused. So it's not that pre-COVID we didn't have a homelessness crisis; it was just more varied. And so now post-COVID, because folks came into the system through the COVID relief program, through GA expansion, et cetera, we have a better understanding. But I also think, as the BHFA report notes, is, also in part because of COVID and more people moving here, housing prices have skyrocketed. for purchase, for rent, and so more people are getting pushed out of homelessness, into homelessness because of that. We're seeing in a lot of jurisdictions where like we have voucher systems and vouchers like Section 8 housing supports, and people are having to give back their voucher because
Yeah.
there's
Well, and
no
Section
place.
8's about to get slashed.
Yeah.
Can I don't know if this is a helpful 101 for a new member of the committee, but do you know how the point in time count is done?
Yeah. No,
Okay.
I'm familiar with it from health and welfare. I just,
Oh, yeah, that's right. Okay. Yeah.
I'm just wondering what the real status of the real unhoused, because, it's pretty alarming, 3,500 unhoused. Are they really currently unhoused? Are they housed via GA, winter,
Mhm.
shelters, et cetera?
So the,
I'm just trying to,
It's a good question because
Yeah.
from the numbers you've just talked about, it sounds like we have roughly 2,000 housed at the moment.
yeah, we have through those programs roughly 2,000. We know a lot of people couch surf, and I think a lot of people see that as a solution. But I think from our perspective, that's really concerning because not only does that mean that those people don't have stability, but also people have leases that say you can have X number of people in your house. And so when you have other people couch surfing with you, not only is that person at risk, but you're actually putting the leaseholder at risk of being evicted and then further adding. So we really don't see that as a viable kind of solution to address the crisis in Vermont.
okay, got it. And if I can go on to the second paragraph. So we've had a couple reports over the past, whatever it's been, 3 weeks or 2.5 weeks. Population's flat. So why so many more houses? I mean, I know these aren't your numbers, but you're you do this all day, every day. Where's the number of houses coming from? The additional almost 40,000, 30 to 40,000. Where's that number come from?
So I think at least according to VHA's report, they say we need that to quote
I
meet
know I've heard
the
that,
vacancy
but
rates.
just any insight would be helpful.
Oh, it's somewhere on our desks. Is the real breakdown of how they get that
Well,
number.
I understand a couple
Yeah.
of, houses atrophy.
19% of our housing stock is considered atrophied.
Right.
So while we have a flat to slightly growing population, we have decaying housing that's not being replaced. And then we have more existing units being turned over into, 25% of our housing stock is second homes.
No, not quite that high. I think the new VHA, it's now down to 16%. Oddly,
Okay.
because so many people moved in full time
Okay.
actually during COVID.
So somewhere on the desk here, we have the range is great because we did have a lot of COVID migration into the state. So if we kept our current rate of COVID migration or people moving into the state, we did see a jump in older populations moving here.
I remember that.
So that's where the 36,000 comes from, is to replace to replace blighted housing and bring it up to code and habitability, to house people who are unhoused, to match the rate of growth we should see as a state, depending on the population. If we're going to have 5%, 5% rental vacancy and 3% housing vacancy. We have less than 1% vacancy in most part of the state still. So it leads people to make difficult and expensive choices with their housing.
But we have, we have lost quite a
I
bit of.
remember that. I looked at it last night.
Yeah,
That's why I'm asking about the, it didn't all add up to 25 to 30,000 units. So,
Right.
flat watch.
24 to 36,000.
Over like 10 years.
It's over a period of time.
Until 2029.
Yeah.
Right.
It just makes some assumptions about growth, which I don't see in any other trend that we're seeing.
But partly because it's a chicken and egg. We need the housing to do the growth.
Right.
And I think we also, and we'll hear this during the course of the next couple of weeks, we have lost significant full-time housing to either to the things Keisha has just talked about, but we also have seen with the cost of housing, that is but that in particular, the cost of rental housing is a big driver for some of our new families and people that
I
are
get that.
homeless.
That's not missing housing. It's expensive housing.
Well, we also haven't had Kevin Chu in,
And which we're gonna have.
who, I don't know if you remember me asking,
Yeah, yeah,
is
no,
it still
yeah.
the case that we have 25,000 open jobs and 1,000 housing listings? So part of our issue is where we see like our flat population is a policy choice we've made because people are foregoing jobs and not able to stay after college,
That's
things like
all.
that.
It's all
Yeah.
good.
Yeah.
I'm
So
ready to move
they're
on.
one of the- And also, our short-term rentals have doubled, taken a lot of long-term housing off of it.
I recognize it.
So that is, there are a bunch of drivers that are, great to have all these things, but they have had significant impact on our long-term housing. So,
Thank you.
Yeah, and the
Yeah.
VHFA report, I think also by jurisdiction, you can really see like short-term rentals, the seasonal rentals, like I know Ludlow, for example, is like about 50%.
85% owned by seasonal renters.
Yeah,
So is,
Owned by
Yeah.
seasonal.
yeah, so I think jurisdiction.
can I make one more
Yeah,
point?
and then
This VHFA works with the state housing and community development office to get this number too. So it's like, verified with ACCD as well. This is the number they agree on as well.
Thank you.
And I think, one thing I also want to lift up that I don't think is lifted up enough is also kind of the significant racial disparities within housing and homelessness in Vermont. And so looking at housing policy, for example, in 2023, this is using the VHFA's dashboard, just 27% of Black Vermonters own their home, while for white Vermonters, it was 74%. And so obviously there's kind of a legacy of kind of systemic racism in this country, the kind of racial wealth divide, I think that really drives that. And also in the homelessness side, Black Vermonters are 5.6 times more likely than white Vermonters to be unhoused. And so I think those are two really important facts that need to be kind of considered as we're talking about solutions. And so I know LAB and others are really focused on how do we bring equity to kind of housing solutions. And I think that is a really key thing that should be considered moving forward. Also, I think it's really important to note, when we talk about the costs of housing, when we talk about the costs of the homelessness crisis, we often just have to think about the numbers that the state is spending. So like we're spending X dollars on GA or Y dollars on VHCV. What we often don't talk about are the costs that aren't considered, which are the kind of impact costs for failing to address the crisis. And so when you don't provide someone with shelter and they become unsheltered, those costs don't just go away. They just get shifted somewhere else. They get shifted to municipalities for policing, for first responders, and get shifted to hospitals because ERs become the first point of contact for folks. And so the cost of not addressing the crisis is significantly more
mental health.
et cetera, than actually addressing it on the front end. And so if I think you do a cost benefit analysis, kind of providing shelter, providing housing is much more effective and efficient than just kind of ignoring it and having that become unfunded mandates on municipalities. And lastly, before kind of talking about solutions, I think it's really important, I think, from the folks that we work with and talk with constantly, from the housers perspective, from the homelessness kind of provider response perspective, is the need for real kind of continuity and clarity about like what is the plan and how are we going to kind of sustain that plan. I think one of the concerns we've heard, for example, on the shelter and homelessness response side is a lot of those funds are one-time funds. And so like as a manager, as a developer, like how do you plan long-term? How do you have a long-term solution when every year you're relying on kind of one-time funding and not knowing how much you're going to have the next year? And I know the same on the development side, like how, we know like where we need to be in Vermont, but like how do we have the funding plan to kind of keep us there? And so, we'll talk about some of the solutions, but I know like we have a pipeline of production right now. We have a pipeline of affordable housing. We have a pipeline of production for shelter capacity. But how fast and how easily that pipeline flows is dependent on continuity of funding. And so just having that continuity, I think, is really, really important.
And I might just point out, because it's something I have a bill about and we'll hope that we include in our housing bill, is an additional stream income generator for housing, which we you know, which we basically just don't have enough money to do the housing we need to do.
Yeah.
And, so, you know, I think we'll be addressing that.
Yeah, definitely. I mean, obviously, everyone also understands the practicalities of like there's 2-year legislative sessions you can't project out, like you can't lock in. So for the future, but I think just having a little bit more clarity in terms of what the long-term plan is, I think would be really appreciated. And so moving into some solutions, I think from our perspective, obviously the solution to the housing crisis or to the homelessness crisis is permanent affordable housing. And so even talking with our shelter providers, you know, we have 3,500 unhoused people in Vermont. The goal is not to move to 3,500 shelter capacity because we know that that's hopefully a high point, and as we build more housing, that will reduce. The kind of the goal is to kind of have this basic backstop program and then to fund as much as possible into the permanent solution, which is permanently affordable housing. And so we see that the opportunities kind of taking place in a few areas. You know, I think from our perspective, continuing significant investments in VHCB is extremely important. You know, they are kind of the, as I've heard from a lot of people, kind of the mothership to kind of building housing and getting permanently affordable housing going in Vermont. They work across all areas from housing to kind of shelter capacity, market housing, you know, nursing facilities, et cetera. So I think kind of having them have the funding that they need to kind of keep their pipeline moving is really important. And so our ask of the legislature this year, in addition to the property transfer tax, a statutory share is 80 million for VHCB. And in terms of what that would achieve for Vermont, that would produce 385 to 500 additional units. It would increase our shelter capacity between 30 and 60 shelter beds. It would create new home ownership opportunities. It would create more farm worker housing. So I think across the board, those investments would really kind of help start to put a dent in the crisis that we have. I think just also want to flag VHCB, the legislation you all passed last year provided VHCB with, I believe it was $30 million if there was leftover ARPA funds. And that money was reappropriated. It was moved into, I believe, general fund dollars. And so VHCB didn't end up getting those dollars.
You're talking about the budget adjustment.
Yes.
It's not over yet.
Okay, well, I think this is my plug for, why I think it's really important. And just kind of give a little sense of where VHCB is at right now. To my understanding is they have, I think, you know, about $13.5 million to spend that's unallocated, and they have over $50 million in projects that are put before them. And so, you know, we're really focused on the solution. Keeping that pipeline moving is really important. And I also think when you're providing VHCB with that funding and stability, but it also tells the kind of nonprofit affordable housing developers is that we can keep our projects moving, we can keep our planning moving for future projects. But when that starts to slow, you know, there's a lot of costs that go into development of a housing unit that happen before they even make a pitch to VHCB. So, you know, it's like site, you know, identifying places, doing some of the prep work, et cetera. All those are some costs that they don't get back. And so I think it's really important for the housing developers to know that this pipeline is continuing so they can continue doing their work, but it's all kind of a connected ecosystem. And so funding VHCB really kind of keeps that ecosystem moving forward.
I think the thing I'm missing in your solutions is the solutions are so much bigger than physical housing, supportive housing. I mean, our solutions, I mean, given the range of people that come into homelessness for a range of problems, trauma, domestic violence, drug addiction, cost of housing, I don't see any solutions here. And I'd love to have you think, because I know you think more broadly about the triggers into homelessness, much of which are trauma, domestic violence, and some of the human disasters that happen in all our lives. Mm-hmm. How do we begin to really invest more in addressing trauma at an earlier age, and addressing trauma in people's lives? I mean, I would love to see also a proposal on solutions, and not necessarily for this committee, but for all your other committees that you interact with. I mean, I think we do not address some of the root causes of homelessness soon enough, so that we not just contain costs from a state point of view, but protect lives and improve and hopefully support lives earlier.
Yeah.
Okay.
I mean, there's a complete other side of that coin,
Right.
which we've had Pew Charitable Trust and some of our national housing partners and advocates come in and talk about,
Right.
which is the numbers just entirely pan out. It's like a national scientific research consensus. If you build a significant number of units and you keep that vacancy rate open for churn, then
Yeah.
you
Affect all these things.
you significantly decrease slow any increase in the cost of rent, keep it flat, and you significantly decrease homelessness. You know, that at some level we want to help people, you know, that's important. And a lot of people just need, you know, a warm, safe place to live to then sort things out and, you know, be able to take care of themselves. Housing solves a lot of those problems to give someone the ability to then sort of reclaim, you know, other parts of them.
Absolutely, but I think it's all and.
Yeah. Oh, I totally agree. And I think that's why I think from our perspective, we really support like the housing first model, which,
Yeah.
you know, Pathways is deployed extremely effectively in Vermont, which is meeting people where they're at. The research is really clear that if you
Right.
get someone into a home and stabilize them, even if they may have substance use issues or mental health
Mhm.
issues, that gives them the stability to begin to address those issues in providing the support. So it's not like a, you know, again, like I think it's not a silver bullet, but you need to kind of have that first step, get folks stabilized, and
Right.
also invest in the kind of wraparound response supports that are needed.
Well, and I mean, if you sink the cost into a multi-story, multi-family building that has shared stairwells and, you know, the kind of infrastructure that has people running into each other, that breaks a lot of isolation, that has people naturally checking in on each other. Like, government doesn't have to solve all of these problems. Humans used to just interact more. And, you know, especially in our rural state, any opportunity we can give people, especially seniors, especially people who need other supports, to just, you know, have that community space together, solves a lot more problems than government can.
And I think, you know, things that this legislature has done, even just this past legislative session, I think on related issues like harm reduction, like the overdose prevention center legislation, you know, the more we can do to kind of move our drug policy response to an evidence-based harm reduction strategy is extremely effective at kind of also hitting this kind of intersecting issues.
On our 585 shelters beds that we have now, are you including the beds that we have in our domestic violence safe places?
Those are kind of state funded. So I think I'd have to double check. I think the
Do we include those in that
but
585?
I'd have to double check that. Let me get
Yeah,
back to you. on
because
that.
I know, I mean, it's not a huge number, but they exist.
Those were all OEO funded
Right.
beds. Yeah.
Well,
OEO.
Office of Economic Opportunity. Yeah.
embedded in the Department of Children and Families.
But let me double check
Which we
around
have
the
represented.
beds.
Right, sorry, I didn't mean to interrupt your solutions.
And so also, I think one of the things we learned from the housing needs assessment, it's not just kind of tackling kind of affordable housing, but also middle income housing. So I think it's also why we really support investments in BHFA, in particular the Middle Income Homeownership Development Program and the Rental Revolving Loan Fund.
Yeah.
That I think are really key to starting to ensure that folks kind of at the kind of low end and also middle income ends are able to kind of move into housing in Vermont and have those opportunities. And so again, these are programs that have been in existence for a couple of years now, have shown, good return on investment, have been able to kind of scale up. And so I think continuing to support those programs is really, really important as we kind of move through this crisis. I think manufactured housing is also something that we really need to prioritize. You know, there's lots of opportunities. We've seen a lot of programs in place over the last couple of years. Manufactured home improvement and repair program being one, as well as, healthy homes and rapid response info programs. So these are really programs that have kind of enabled, the manufactured housing kind of parks to have the infrastructure that they need and then the individual homeowners within those parks to be able to, if they need a small grant to be able to get that space up to living and safe standards, they have the ability to do so. We've been able to turn over a number of units and keep people housed and create more units by doing that. And so I think that's a cost-effective way for Vermont to continue to address the housing crisis. And then I think, again, as I mentioned, we have huge racial disparities in homeownership. We have huge racial disparities in homelessness in Vermont. So I think from our perspective, continuing to support the LAOB and their great work is really, really important because, we have all these solutions. It'd be great to get housing, but if we don't ensure that we have equity within that, then we're not really addressing a core part of the problem right now. So I think from the kind of ultimate solution side, those are really the key investments that we think we urge this legislature to consider. Some of those are BAA opportunities, some of those are big budget opportunities. So I'm just going through both at this point, if that's okay. So the second area that I think we're really concerned about and urge continued support for is homelessness prevention.
Here we are, right.
And so, homelessness prevention is, we've talked about the solution, which is housing. We've talked about the problem, which is homelessness. This is really about not making the problem worse. And so we have fantastic infrastructure in Vermont of homelessness prevention supports and services that are really dedicated to make sure that people who are at risk of homelessness don't move into homelessness. Key among those is the HOP program, which is funding a lot of homelessness prevention services. And if I've pulled the sheet, but this HOP is funding programs across the entire state of Vermont. So in everyone's community, we're seeing
HOP stands for
the Housing Opportunity Grant Program.
HOP.
Yes.
We don't call it the HOG program. We call it the HOP.
Yes.
So we just
I
admit
don't
that
know the history for why they
think that's
chose that acronym.
Yeah, right.
Can I ask a question, Chair?
Yes.
I think I just heard you say that we have exceptional programs to keep people on the fringes from becoming homeless. How long do you think we've had that as exceptional programs, and how would you reconcile that with that we have the current highest per capita homelessness in the nation?
So I think we have great programs. We have not adequately funded those programs. It would be my response to that. So we have an amazing homelessness response infrastructure in terms of shelter providers. We have extremely dedicated folks working on the ground every day. But as I mentioned with coordinated entry, we have a great system. We just don't have the outputs that we need. And so I think it's continuing to expand the outputs that we need. So with this, it's continuing to fund the housing navigators and expanding the number of housing navigators, landlord liaisons, the folks that are going and working with landlords. Because the vast majority of housing opportunities in our state are through private landlords. And so talking with private landlords, talking with them about, taking risks, providing subsidies if they need, financial assistance to help someone with a deposit, or, if they want security that if there's damage done, they can get some money back. Those are really key things that I think we need to continue to invest in and expand investments in.
So 27 million is, to respond to Tom's question, when you say we have this great program, but it needs to be funded, 27 million, the proposal here would adequately fund that program. What is it funded at?
So this is, I think, where we get the kind of practical realities of what we thought was possible ask versus the actual need. This is not reflecting the need. This is reflecting what is currently this is how we don't backslide, I guess, why I framed it that way. This is what is currently being funded with a 4% COLA.
Mhm.
So 27 million is current spend.
Yeah.
We're hoping for 4% increase in FY
26, yes. So this is not expanding. This is not making the problem less bad. This is just keeping it from getting worse.
Okay, so this is sorry, Keisha, I'm going to give it a second. I just want to drill on this one. So 27 million is what we're currently spending. We're hoping for 4%, but it's even
The 27
with 4%.
incorporates at 4%.
Okay,
Yeah.
great. Incorporate. What would be the true cost, not the realistic cost?
So
Just to
that is
give us a
something that
notion.
we are working on right now and trying to understand. I think the problem is large. We're actually working with HHEB right now on this matrix that will understand the universe of who is unhoused in Vermont and what specific needs they have. What is the ideal shelter system in Vermont look like? What does the ideal service support system in Vermont look like? But that is a massive amount of data that we're kind of going through right now. And then we're also going to check that data with all the providers across the state to make sure that the data reflects reality, and then use that to come up with, what we think
A real
it should
figure.
look like. But like, just having had conversations with folks, like, we knew we couldn't come in here with like, we need $1 billion and, have
Right,
that.
and here's how we're gonna raise
Yeah.
it. That, we'd be welcome
Yeah.
that. So Keisha has a question and then David.
Well, first of all, I just really want to applaud you and HHAV. I mean, I've often said, like, you're a coalition, but that means you have to really prioritize, and not just come in with everybody's wish list.
Mhm.
And I mean, this is incredible work. I've just seen this document be a lot longer and a lot more vague. We just need all the money, right? And if we all had all the money, hopefully we would solve this problem. But this is really
Right.
good work. The HOP program, some of these other buckets of money. One of my pet issues has been that it feels like the motel system is left out of the conversation, right? Like, Brenda and I have had this conversation a lot because she talks to a lot of the Indian motel owners who are probably like 60 to 70% of the owners of the housing participating in the motel programs. They have staff that are kind of besieged and are not shelter coordinators, did not go into social services, they went into hospitality, and so it feels like where we have the most people, we often have the least contact. Is any of this designed to sort of permeate that wall and help coordinate? And I will just say, for new folks, we've had some of the hotel motel owners testify and talk to us and talk to housing providers and just say, we've been trying to consolidate people who have certain needs in certain motels because they all know each other. We've been trying to talk to the state about rent to own agreements of our motels. Like, these aren't going to be easy to convert back into tourism. And I have directed my concerns around this at DCF, but I just feel like everyone kind of leaves these motel folks out of the conversation when they've actually been housing the most people for the last 5 years.
So I think I know a number of the service providers right now are at the hotels and are trying to do that. Again, I think it's a resource issue.
Mhm.
It's just not capacity. Caseloads are massive. And so in an ideal world, we would have the staff to be able to, they would have the staff to be able to meet the need, and also have not only to be case managers, but also to be able to say, okay, these are the things that you need, or these are the resources that we have, and be able to match that up. And so that's part of the funding, particularly with the
I was
ERAS that
gonna
we'll
say,
talk
that's where you
about.
need more navigators,
Yeah.
and more case managers.
Exactly. So some of that is happening right now, but we could always use more. And I think the other issue, though, which when we talk about the GA Emergency Housing Task Force, one of the key recommendations from that task force is to have state agencies fully participate within the kind of homelessness response system, so coordinated entry. So right now, folks in the hotel motel program are not necessarily getting connected with coordinated entry. And so we're not getting connected into the system that is supposed to be triaging and matching resources and all of that. So I think and it's also, it's not because folks don't want to do it. It's just, ESD state agencies are, overworked and have big caseloads. And so making sure that everyone has the resources they need so we can actually make the system itself is great, make it actually function the way it should function, because we have all the pieces moving into it. But I totally agree with you. We are nowhere near where we need to be in terms of making sure that folks in the motel program are getting connected in and have these services. I think there are certain things legislature could do to start to address that.
David had a question.
I do. So, thanks for the testimony. This is really helpful. I'm going to piggyback off a comment that Senator Chipman made, and reflect the concern of constituents that my constituents in Rutland County, which is one of the epicenters of the voucher or motel voucher system, is they don't have a problem spending money to help the folks that need this lift. But we're not seeing metrics to show that the money invested is actually having the net desired results, which is a comment which I heard across the table earlier. And I'm wondering if you can help us out to make us feel comfortable that all the hundreds of millions that we're investing are actually producing the desired result. And that should always be a metric for a government program, that there's something, whatever investment we're making, we're reaping the desired result. And I'm wondering if there's anything you can offer, not an innuendo of a particular individual, but of these 3,500 or whatever category you're going to use for who we're targeting these funds towards. That's actually an effective program.
Definitely. I mean, so that's a whole bunch of different programs, but I can kind of go through a couple piece by piece. I think first off with the GA program. So I fully recognize that Rutland in particular, I think Winooski, there's certain jurisdictions, Brattleboro, where they had, a disproportionately high number of people come into because there was just more motel capacity. And I think one of the issues that we would 100% support, we think needs to happen, is that services kind of meet the needs. And so we moved a lot of people to Rutland, but the services were not brought into Rutland at the scale that they needed to be able to provide services for all those individuals. There was also issues with, kind of the conditions that folks were living in. I mean, there was a whole bunch of issues, but I think from our perspective and from talking with providers on the ground, the GA program has kept, first, I guess the GA program only applies to people who are eligible. So only people who the state has deemed as vulnerable. So seniors, people with disability, people with children, people fleeing domestic violence, people who's had natural disaster like their house burned down or the flooding. So it's a very small subset of Vermonters who are eligible for the GA program. But for those folks who are eligible, it has been a lifesaver in talking with folks on the ground, because it has kept them off the streets and out of unsheltered homelessness and in a secure, safe place. And we know from lots of reassurance that when people have the safety and security, they're able to kind of, if they have mental health or substance use issues, be able to have the space to begin to address those. If they're looking for employment, they have that stability to get employment. So there's lots of ways that has been measured in terms of the effectiveness. And I think that's also one of the big lessons learned during COVID, pre-COVID. There was a lot of use of congregate shelter. And during COVID, we were forced to move away from that model because of the need for social distancing. But one of the things that we were able to learn through research during that period was that moving out of congregate and into kind of the individualized shelter space had huge benefits in terms of safety of individuals who were unhoused and staff, the ability for them to be able to get stabilized, get employment, continue education.
Well, that's it. So those are the statistics that I'm personally looking for.
Oh, and I can show
you talk about employment, something other than just a request for money.
And I could send you, there's a lot of peer-reviewed research I could send you on those pieces. But yeah, so those programs have been extremely effective from that perspective. But the problem is we have not provided, like, as I mentioned, coordinated entry. We have this system, we have this great backstop, which is GA, but we don't have the requisite supports that are needed to fully address the crisis. And we also don't have the housing to move people out of. And so I think, rightfully from some people's concern is like, it's a perpetual program, but it's going to continue to be necessary perpetual program until we invest in the housing and have those outputs for folks. Because the alternative is what happened back in September when the caps went into effect. You literally had shelter providers providing tents to families with children because there was no place for them to go, or to providing tents to seniors or people on oxygen because there was no place for them to go. And so I think from our perspective, continuing that program, keeping that what happened in September from happening again is really, really important. But again, investing in, I totally agree, like we need to invest in the services, we need to invest in the kind of ultimate solution.
I mean, ideally, your housing navigators and your case managers would be working with individuals and individual families. In Rutland's case, finding the right school, finding jobs, finding the right adult education training, finding the right workforce development, connecting jobs with people who are willing and able to work. I mean, it would be ideally much more effective, and people would be integrating into into full-time life, maybe in Rutland, if we had not only the best system, but the most, funded resources to enable exactly the full range of services people need to become integrated in a productive way in their community.
And I get that. And
Yeah.
we talk about this in Rutland all the time. This
Oh,
is a
yeah.
subject which is right in front of us.
This is Project Vision.
And I'm just not sure that, we've been studying this problem long enough. We've been investing so much money. All we're hearing is requests for more funds. We're looking really for justification for the money we're spending and then the additional money that's being requested. And we're not seeing that data. I'll tell you, having just, again, come off the campaign trail, constituents are saturated and they want to know if the dollars are being wisely invested.
Mhm.
And
Yeah, I'll provide you with those sites, because I think those are, and I think one of the other, unhelpful things that has been brought up that the data doesn't support too is that the hotel motel program has been this backstop for people who are not from Vermont. And so,
I didn't say that.
oh, no, but I'm just saying, I know that that's like another.
It is a hot topic.
Yeah,
And
that's great.
lots of folks have, I think they've addressed it.
Yeah. Perfect. Yeah, but I think, the data show that it's like 4% of the folks in.
Tom has a question.
I think to pick up on Senator Weeks' point, metrics that would be useful for me to know that these funds are going towards addressing homelessness is showing how many success stories there are that people that use these services then stayed home for a longer period of time and that we're seeing that result. So that we aren't just giving fish out, we're teaching people to fish so that they can provide for themselves. And we're getting to places that we're seeing a result in fewer homelessness because we're not currently seeing that. So metrics around the success stories of these programs, I think what needs to be heard more to really know that throwing more money at these problems is resulting in less homelessness, which we're not seeing.
Okay.
Patient.
I just do want to bring us back to like our greatest metric of success is going to be building more units that people can afford. We're like, this is where I say the governor and I agree entirely. People get to the end of this continuum and there is nothing for them to move into. There is no final, apartment they can afford, house they can buy, etc. So that is, even more uniquely a New England and Vermont problem. It is not, we coordinate and then we find them this magical place to live that, that no one found before. And so the problem, the sort of like challenge that I know Frank and so many are facing is they're trying to prove a negative. They've kept a lot of people from crisis, and yet, anyone who ends up in those situations is costing us a lot in police services and hospital services and, expensive, non-ideal shelter situations. But then we haven't done the work to change our permitting system, to change regulations so that we can get density and we can get more housing built. And so, while Human Services has the conversation about what do we do to help stabilize the individual, it's just so unfair in the whole system that there's nowhere for them to go when they have that stability. So you're welcome to join me in Middlebury when 200 and some odd units of housing are we break ground on that.
Zeke invited, I think, the whole committee.
Yeah.
I will forward the invitation because I'm hoping we will all go. And I'm actually hoping that we can build my secret hope. You may have seen my response to Zeke. My hope is that we could build maybe a little bit of a housing tour that day, anchored on that event. So let's, well, I mean, it's an idea because if some of us are going to go.
Oh, you mean it because they're breaking ground?
Yeah.
You mean like other?
Exactly. Go to other places.
Yeah.
Yeah.
So, and well, like I say, and we have been addressing those things, with your leadership and with this committee's work. We have been addressing those things.
Right. I mean, to me, that's gonna be our metric of success is
Right.
you
More
know,
housing.
more units of housing.
I just given our time before I go to David, just given our time, what else do you want to make sure you share with us before we end? And then is there more that because you have a rest of this stuff?
Yeah, I can definitely try and run through this quick, and I can just
David, can I
reply to
hold for a second?
one of our,
Well, I'd like to just address
Yeah.
the comment. It's, I want to take you a second.
Yeah.
So I understand the need for the units, but I'll give you an example. In my county alone, I've got 2,200 units that are offline.
Right.
Those are, so I bristle at the concept of everything has to be new.
It doesn't, God, that's what VHIP is.
Well, I keep hearing new.
Oh,
Do you keep hearing new?
No, 'cause
you're-
New to me also means newly available.
Okay.
yeah,
So-
I
Just
think
wanna make
our
sure.
notion of new.
I mean,
is
that's like when we talked about manufacturing, a lot of that is just repair programs and like.
So I get that. I
Exactly, yeah,
understand that.
100%.
I'm talking about 2,200 units.
Yeah.
Right.
Some of which are manufactured homes, with majority are not.
Yeah.
Right, and
That we're
VHIP
addressing.
is.
And I understand VHIP.
Yeah,
I would love that. I mean, you heard me go after historic preservation and all kinds of other things because.
Right.
What are we doing? We have 90% of our housing stock we need to fix up, and that wouldn't affect anybody with a greenfield being developed. So we completely agree in that.
Right.
Any legislation we could pass that.
I think one of Frank's asks probably is to support the VHIP program for both improving and renovating housing that we
Yeah.
already have and
Yeah, we
bringing
do
back
support VHIP.
online and
Yeah,
creating
we believe-
ADUs.
yeah.
Because both of those programs address this exactly.
Yeah, no, and as y'all talked about, this is a continuum. There's not one solution. We need to do a whole bunch of different things, including,
Right,
fixing existing structures, building new units. There's no one size fits all solution for this. And one thing I would love to plug out for Rutland in particular is Pathways. We really would love to expand into Rutland. So Pathways is an evidence-based housing first model for people with severe mental health issues. They provide place-based services. Their success rate, they have great metrics showing their success rate, and they're trying to expand out with a $500,000 request. And they would get, I think, nearly that much from federal matching funds to expand into Rutland to be able to do 85, to work with 85 folks in site-based units. So that's something I think would be really, really valuable. But so we have a number of additional things that we think would be helpful at keeping the problem from getting worse. And so that's where that whole middle section around investing in homelessness response. That's where I talk about Pathways, where we talk about HOP, also ERAP dollars, which were federal dollars
yeah,
that
they're
are going away.
soon, as I.
And those funds are going to go away, which means there's going to be positions going away in almost every single AHS district in the states. Which means that everyone's community is going to be impacted by this. And again, these are housing navigators. These are folks working, connecting with the hotel motel program. And so we see it as vital to kind of not make the crisis worse, to kind of have the state ensure that as we're thinking of HOP, expanding HOP to include those positions as well. And then I just have a couple minutes left. Just don't want to leave the last part around emergency shelter. So I led off the conversation talking about emergency shelter and the fact that we have 3,500 people unsheltered on any given night, which is an undercount 585 beds. The GA program has really functioned as the backstop for vulnerable Vermonters for that program. And so just want to lift up a couple of really important dates coming up. So right now we have winter weather protections exist. And the winter weather protections were December 1 through the end of March. So going on April 1, we revert back to the previous system, which is, and again, we're only talking about eligible Vermonters, so vulnerable Vermonters, but they are given a maximum of 80 nights of GA access, and there's an 1,100 room max cap in GA. And so if you recall what happened back in September when those caps went into effect, we saw a mass unsheltering of hundreds of the most vulnerable Vermonters into a system that had zero capacity. And so that's when I was talking about, we were literally giving tents. Our providers were giving tents. They were actually using their own funds to buy tents for people, families, people on oxygen, et cetera, to go, and there was nothing else that they could do. So I think one of the key asks from our perspective is within the DAA to ensure that we extend the winter weather program through the end of this fiscal year, to ensure that on April 1st, which as you all recall, that we're still on the ground, I think last year on April 1st, we're not exiting people into a system that has no capacity. And I think not only from the humanitarian side and kind of the impact on municipalities who are going to have to then, fund those things like first responders, emergency rooms, et cetera, that are going to spike. But also, it would give the legislature time to consider, there was a GA emergency housing task force that met from last July, I think we started through December. We issued a report to this legislature.
Which has been highly sent around to all.
Oh, awesome. Thank you. And that goes to a number of recommendations that we think this task force included providers, it included folks working in designated agencies, it included like a very diverse set of folks who are working on the issue of homelessness and intersecting issues around homelessness, around kind of what the system should look like. And so that task force came up with a set of recommendations, one of which is, this 80 night cap, where did that come from? It was really just a compromise. And so I think one of the task force's recommendation is instead of having arbitrary night caps, we should look at the actual data and base eligible nights on how long it actually realistically takes people to move from homelessness into housing in Vermont. So again, from a metrics perspective, we think it's really important that we tie decisions around length of stay capacity to the actual length of stay. We have great data on that. And that could be something that could be evaluated every year, but we think whatever that year's max nights available should be related to the time that it actually takes people to move based on the data we have. And so I think
And what is that at the moment?
like over 400 days right now.
It's over
Over
400.
400 days.
Wow.
Yeah.
So, and before the pandemic, it was like 50.
I mean, I talked with folks like,
And
I
it was
talked with
200.
Sarah Russell,
Yeah.
Pre-pandemic Sarah, talking with Sarah Russell, who's the Chittenden County, who's the Burlington, work center for homelessness response for Burlington. And, she's like, pre-COVID, I would go show people multiple units.
Right.
Mhm.
And
Sure. What is that?
it's a world that doesn't exist anymore.
Yeah.
And so, yeah, the average is over 400 nights in Vermont right now,
So over a year.
over a year. Yes, and so that is literally what this is hard data that we have, what that shows. And so, create, in particular, when we're talking about just vulnerable people, like we would love to see everyone housed, but again, like we knew we couldn't come in with certain asks. But like, just like we're just concerned, we're talking about vulnerable folks, it takes 400 nights. So giving them 80 nights is not realistic. It's not connected to anything real. They're just going to get exited to homelessness.
Can I just say too, I mean, the whole country is and was facing this, especially, getting people into non-congregate situations and, needing a increased number of units when the whole country hadn't been building housing. You might have a farmhouse that had 3 generations in it, and now parents are divorced and grandparents are here and kids are here and they have kids. And the parts of the country in the pandemic that built have gotten this problem under control. The Austin, Texases, the Minneapolises, parts of New York, they built to accommodate this crisis. And the places that haven't have $1 million home prices like Boston.
Right, but in all fairness, we have been building to try and meet it, just not fast enough or enough, but we have used over $600 million.
The amount of money we've used isn't equivalent to
To the number of houses.
we built about 2,000 units.
I know. So I know this clock, just for everybody's information, is a minute fast. So David, I know had the last question.
So,
You did, didn't you?
yeah, a little bit.
Oh, okay, Randy.
Just a basic question. When a person finds that they may be facing homelessness, what do they do?
So
What should they do?
connect with the local homelessness response system, which is,
How would they find out who the local homeless
we have,
system is?
there's like referral processes. There's, a lot of the local providers are in the communities. They have relationships with folks. There's
Street
word of mouth,
outreach.
there's street outreach. There's a lot of mechanisms that folks do.
What I find, and I've got several constituents who have this issue, they're potentially facing homelessness, death of a husband, those kinds of things that affects their income stream and all of their house now, not able to continue in the present situation. They find that they get a caseworker through something like AidWell or whatever. They try the local OEO office. And what I find is this extensive fragmentation And often one side does not know what the other side is doing. And only some people who have been in those kinds of roles for extended period of time know all of the various pieces of this very fragmented system to actually get them the help that they need. And that to me is a major problem that I certainly see, and it seems to be continuing.
Yeah, I think I totally see that. I think, again, one of the issues is because so much of this is relying on one-time funding, it's hard to keep people. We also are not, we're asking people to do some of the most difficult work in the world and paying them, $20 an hour, which is not livable wage in Vermont for most places anymore. And so kind of having, when I'm talking about supporting the infrastructure, it's like all those pieces, we have a system, but the system only works if it has the outputs. And in terms of case management, we know, I'd have to look in that specific jurisdiction, but there's, 6+ week backlogs or 6-month backlogs for case management because there's just no capacity for people to help or people to go. And so it's really just, the system exists, system works well in theory. We have amazing people, but there's just no output.
The weight of the need is
Yeah.
collapsing the pillars that are supporting it.
The issue is the organization of what we have right now, managing the process is not working well. That's my point.
Mm-hmm.
And that is one of the things that's causing the kinds of slowdowns and lack of response time and so on that I think we're seeing. The second question that I had, and I don't expect you in the time we have to answer this, but we are number 4 in the United States in terms of homelessness.
Okay.
What characteristics do we share with the top 3? Is this the same problem, or are there different problems that are locally focused? And so that again was another question.
Right. If you could answer that.
Yeah. So in terms of
we need to adjourn.
the top, so I think above us are Oregon, Hawaii, and New York on that list. Hawaii, I think because of the fires, moved up quite drastically. New York, I believe it was New York, some issues in New York City. And so I think different than Vermont. I don't know enough about Oregon to know apples to apples.
Did that have something to do with the number of in-migration of people who are poured into New York?
I don't know the answer to that question, but I do know in Vermont, we went from number 2 to number 4, but our overall rate of homelessness actually went up. And so we dropped, but it's other people went up much more drastically. And I think around the kind of case management and the systems, I think again, the system can only function if it has what it needs to function. And so I think we do have a solid system in place in Vermont. We have the coordinated entry system, which all states use. It's an extremely effective tool. But we have local housing coalitions. So within the Balanced State Continuum of Care, each region has its own local housing coalition. And I join those calls quite regularly. And there's not even the capacity to kind of think into the future because it's I have this person today and I don't know what to do with them. Can someone help me? It's triage and triage and triage because there's no capacity in terms of outputs. There's limited capacity in terms of bandwidth because everyone's understaffed and overworked. So it's just those pieces, I think.
That was my point about the administrative process associated with this may well be adding the amount of homeless we have because of the inability to respond to situations that could be prevented.
Mm-hmm.
I think that's key. I actually am thinking for all of us who do outreach in our newsletters, in our social media, whatever, and maybe it would be helpful for you to send us when Randy has a constituent in Franklin County, who does he call? Get that person needs addressed with each of our area.
Yeah. It is actually really good. TBO, Jessica Rapp up in Grand Isle is awesome. They run a really good program. So I could definitely connect the committee.
Right. You might do that for all of us.
Yeah.
I think we need to adjourn. This is not the last we're going to see of Frank. We welcome you back, and we will probably welcome you back in other classes. We're back here at, I believe, 10:15 for to begin to address housing production costs and financing of housing.